My name's Lisa Langley, and I am from Robinson, Illinois, and I am enrolled in the Certified Medical Assistant Program at LTC. Today, I am going to be demonstrating on my patient Mara how to do a glucose check, which is measuring the sugar in your bloodstream. But first, you want to wash your hand, which I already did. I'm going to apply Germ-X just to walk you through the motion. You want to lather up, make sure they're good and dry. If you go to the bathroom, obviously you have your own procedure for washing hands. But you're going to apply sterile gloves, which just came out of the box. First, you're going to ask the patient her name and date of birth, and you're going to make sure that it's correct on the doctor's orders. So typically you'd say, "Can you verify your name, date of birth for me?" And then the patient would. You're going to pick either the middle finger or the ring finger on either hand. It's kind of, you can ask their preference if you want to. I'm going to go with the middle finger on her right hand. And you're going to open an alcohol swab. You're going to swab the tip of the finger to make it sterile. Then I'm going to pull out my test strip. I'm going to go ahead and I have my glucometer here. I'm going to place the test strip in the top of the machine, and it's going to turn on, and it's going to tell you to apply blood. You're going to take the tip of your lancet off. You want to apply firm pressure to the tip of the finger, and I always go to the medial side. You're going to put pressure on the lancet and then release. The first pool of blood you're going to get, you're going to wipe away with a gauze, which I'm opening now. You wipe it away. You're going to apply pressure, but you do not want to milk. You're going to take the test strip that's attached to your glucometer. You do not want to touch the tip of the strip to the actual finger. You want to just gently touch the pool of blood. It's going to go across. You're going to give your patient her gauze and ask the patient to apply pressure. It's going to give you a blood glucose reading, which is 93, and your normal range is typically anywhere from 90 to 120. That's going to kind of depend on what the patient's eaten that day. If they're fasting, it could be lower. If they've just eaten a donut for breakfast, maybe a little higher. But then you want to make sure your sharps goes into the sharp container. Anything that touched the patient that could have any body fluid or anything of the sorts goes in a biohazard trash. And then that's a glucose check.